Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Heart failure is the topic today in your Neighborhood Health Watch. It's more likely to happen as we get older, but anyone can develop heart failure. While it's difficult to live with any chronic condition, people with heart failure can learn to manage the symptoms and live a full and enjoyable life. But you have to be willing to ditch the bad habits and develop new ones concerning eating healthy, exercising, and tracking your symptoms. And here to get us informed is Dr. Barnett Gibbs, cardiologist with Henrico and Parham Doctors Hospital. Thank you so much for coming. Welcome to First at 4.
Thank you.
What goes on in the body for a person experiencing heart failure?
Initially, the symptoms can be very insidious. Most individuals will really not perhaps even recognize many symptoms. They'll progress on to have some shortness of breath, some fatigue, some things that most of us experience on the occasional. But this becomes very insidious, and it's hard for them to eventually do their activities of daily living. And at that point, it's very concerning at that point.
What are the causes, and is heart failure preventable?
Heart failure is preventable if caught early enough, but in order to prevent it, one has to prevent some of the risks that lead up to heart failure.
Right.
Some of the more common ones are high blood pressure that's perhaps poorly controlled, diabetes also that's poorly controlled, as well as some other factors. But some of the things that we hear about commonly that are heart healthy things that we need to think about are also those things that lead to heart failure as well.
Who's most at risk?
Everyone is at risk. The incidence climbs as we get older. Unfortunately, there seems to be a higher preponderance in the African American population than in other populations. But as individuals grow older, really starting from age 40 on, the risk of heart failure increases as we age.
And what are the odds of beating heart failure?
Once one acquires heart failure, it's sometimes difficult to beat it per se, but it can be treated if caught early enough, and we can help ameliorate some of the symptoms that individuals have.
And what are some of those treatment options? How do you protect your heart?
The main way of protecting your heart is some of the things that we talked about. Make sure that your blood pressure is well controlled, blood sugar is well controlled if one is a diabetic, but ensuring that you're on the right medicines, and if those medicines that you're taking those chronically, as opposed to missing occasional doses, as sometimes is the habit.
Is there a checklist that we can use to, I guess, run down to decide whether or not you need to go see a doctor now because you're having these type symptoms?
A very nice checklist would be, if you have some of these chronic conditions, do you have high blood pressure? Do you have diabetes? Is it well controlled? Is it not well controlled? Are you having some of the symptoms that we talked about with shortness of breath, some fatigue? Right. Those are the things that should really make you say, maybe I need to go see my primary care doctor or a cardiologist to determine, is this heart failure and is there something I can do about it?
All right, Dr. Gibbs, thank you so much for joining us on First at 4. We appreciate it.